Hi, I'm Jenny Cannon, and this is my husband, Dr. Cliff Cannon. I am in the co pilot seat today. We're going to make him answer some tough questions that I know all of you guys have wondered or asked us before. So that's what we're doing today.
Thank you. Thank you
Doing a
for
little
having me.
interview.
And I'm not the easiest to corner to get these done. So
No,
yeah,
you're
but I
not.
appreciate y'all sitting me down.
Downtime. What happens after surgery?
Downtime is a bit of a global question. So there's immediate post-operative period where you have open wounds. And so open wounds means no sweating. So stay inside, stay in the air condition, and avoid sweating. So that's typically wounds are closed in about 2 weeks, depending on how many massages you need. But the key thing is once the wounds are closed, then the risk of infection goes down. So this applies to working out, um, SEX,
Sexual intercourse?
correct.
Okay.
Um, and but you realize that if you have a BBL, the goal is to not have any direct pressure on the buttock for about 3 months. So let somebody else do the work.
Got it. I'm tracking.
Okay. And
Okay.
then 6 weeks is a good number. And then after that, 3 months is fully recovered. Um, Start out with some, I would do some walking. Remember, post operatively, the goal is not to be in a calorie deficit, meaning lose weight, because you're trying to maintain the fat cells that were transferred. And so 6 weeks, pretty clear to exercise, 3 months, final result.
So you're saying we're not in a rush to get to the gym. We
No,
can just kind
no,
of
I just,
relax
right.
and get our massages. And that brings me to another point. What's the deal with massages? Like, how many are they supposed to get? What is the benefit?
It's a very
Let's start
common
there.
question. Everyone wants to know how many massages post op. And, when I first started doing liposuction, I didn't do massages, but I only took the deep layer of the fat. This was back when I was practicing back in Georgia. And now I do what's called high definition liposuction. So there's a deep layer of fat and there's a superficial layer of fat. And I take both of them, leaving you only with about a millimeter of fat left. So that's why the girls like the look, is because it gives them that snatch down result. And so massages are required because a little bit medical, but you have more fluid output. It's serous fluid. But the bottom line is to get a good result and to avoid any contour deformities, you got to get a lot of massages. Now, how many? It's a very individualized thing. It depends how much rebound is in the skin. Stretch skin and more space between the skin and the abdominal wall, you're going to need more massages. Really good skin that rebounds well, there's not as much space there, much less massage is needed. But it's individualized to the point where I leave that between you and your therapist, and you'll know when you're wasting your money and not any more needed.
So there's no magic number for the massages. I know. I remember when I had liposuction, and it wasn't so much a feeling of pain, it was a feeling of fullness. And so the massages were a relief to me to get the fluid off and draining and flowing through the body. And when the feeling of relief started to become a feeling more of pain or discomfort, then I knew for me that I didn't need any more massages. It was time.
And
Okay.
the fullness was more from the fluid retention, and then so you got relief after each massage.
Yes.
And then did it get to a point where you didn't have that relief? You kind of wondering if it was necessary anymore.
Right.
Gotcha.
Like this, I'm not getting relief. I'm feeling more just uncomfortable, just sitting here getting a massage,
Right.
kind of thing.
Rather than clinical improvement.
Right. So another question that seems to be popular is, oh my gosh, Dr. Cannon made me look so good. Why am I not on his social media today, the day after I had surgery?
Like I said, I run from social media, whether it's a good thing or not. But I always say I'm a doctor, not an actor. And so I much prefer uh, clinical and taking care of the patient. But social media can fool you, and it's what made me popular. You have to do it. It's the current times. But the key thing is immediately after surgery. So I operate on the patient, and we take photos, videos, or whatever. That's not the result the patient's going to see 3 months from now. They're bruised. One side might be more bruised than the other. Uh, it typically can be squared off more than the final result because the skin hasn't stretched to a certain length. There's something called creep where the skin relaxes and gives you more of a rounded result. So sometimes I'll look at, say, a media post op in the comments afterwards, and I'll say, "Oh, you can't tell anything." Now it is an impressive change from how they looked the day before, but she's going to look a whole lot better 3 months from now than she does immediately post op. That's just the time
Right.
that we can capture the patient. So I'll look also, and I'll agree with sometimes the negative comments, whether I like them or not, simply because that's immediately post op. And we know you lose, they quote, up to 40% of the fat. I think it's much less than that, but my goal is always to obtain the result the patient wants 3 months from now rather than the day after. And it's a journey, as y'all say. Uh, you got to give it time. So sometimes I'll look immediately afterwards. It's a social media post. But that's not how it's going to look 3 months from now.
Got it. And I remember those days when I just had some liposuction, and the very next day I'm looking in the mirror and I'm telling you I look bigger than I did before, and you're saying you're not going to get immediate results. This is not how that works. At 3 months, you're going to have your aha moment,
Right.
and you have to be patient. But we're women, and we want to look in the mirror the next day. We want to jump on the scale the next day. We want to see these significant changes, and it's just not going to happen. And I do remember, oh my gosh, Jenny, come on, 3 months. That's the aha moment, and I had the aha moment. I looked in the mirror at around 3 months and I went, oh my God, I look good. I look so good. Come look at me.
Well, and also, there is the immediate change after surgery. There's fat in you, fat out. But at 6 weeks, the inflammatory response shuts off. And so, kind of like you brought up, you get on the scale more than I wish you would, but at 6 weeks, you start dropping the water weight. So initially after surgery, your rings don't fit the same, your face is puffy, and that inflammatory response cuts off at 6 weeks. So there's a delayed shrinkage, 6 weeks to 3 months, where you start losing that water weight. And you probably lost half a pound at that point. It's delayed, and it runs to about 3 months. That's just water weight they retained from the surgical.
Right. And liposuction is a sculpting tool, not a weight loss tool. I don't think I lost a whole lot of weight, but I definitely lost pant sizes and clothing sizes.
And if there's any one take home answer that you said, is it's not a weight loss procedure. Calories have to go somewhere. So they typically go to places that you didn't have liposuction. So if we lipo the abdomen, you're less prone to this troubled spot. If you continue to gain calories and think, hey, I'm skinny, I'm going to eat whatever I want, it will go to your face, your arms, other places that weren't lipo.
This is so true. Well, speaking of weight loss, I know the new trend, everybody's talking about it, Ozempic, Mounjaro, all these GLP-1s. It seems like the entire world knows about this. What is your take on these little magical weight loss shots?
Magical bullet.
Yeah.
Professional or personal?
Let's hear both.
All right.
Personal first.
Personal.
This is the fun one.
I myself tried it or trying it. We do now have a silver bullet that works.
Right.
We haven't had that in the prior generations, and so it works. What we found out though is it's not only has to do with gastric emptying. It also crosses the blood-brain barrier and affects the brain. So the satiety center is right next to impulse center. So we found that it's curbing desire for a lot of things that people do impulsively. This could be shopping, drinking, drug abuse. And
What about gambling?
gambling? Yes. Same thing. You've been able to drive past the casino, past the casino a little bit easier, right? Right. All right, we aren't going there. The key thing is it works. Now, the side effects can be difficult. Nausea is real, as well as GI issues. And so start low and go. Uh, and one thing that kind of bothers me about the medication and the way it's pushed is when you find the therapeutic dose that works for you, stop there. People say higher, and that's where you need to be. No, if it works at a maintenance dose, that's where you need to be. Um, the key thing is, if there's anything to stress with Ozempic, is protein intake. It is very difficult to gain muscle mass in the presence of Ozempic. So make sure you're getting protein. Either you can supplement with protein shakes, meats, whatever you need. But protein is key intake while you're losing the fat. But we do have that magic bullet now, which is amazing drug. It's a bit trial and error to decide if it's a drug for you.
And so, do your patients that are taking Ozempic need to stop it at a certain point before they have surgery?
Because of the gastric emptying, you're a month ahead is what we recommend. But because we don't want slowing of the gastric contents while you go under general anesthesia. Because if you drink or eat the night before, it could be retained in the stomach and put you at risk for any aspiration during intubation during the surgery. So always a month prior to avoid any complications during surgery.
Got it. Another question that we seem to get a lot is regarding sickle cell and why do we test for that trait and what's the significance regarding surgery?
So, sickle cell trait, we're not talking about sickle cell disease, but just the trait alone. Through my training, there was no discussion of increased clotting or thrombosis postoperatively. The newer literature, 2017, 18, if you dive deep enough, there is an increased risk. They say small but significant is the exact wording. And so I always look for a hematology consult to get their opinion of it. Now, sickle cell trait patients are a large patient population, and so I've seen enough hematology results in their opinion, which is always the typical anticoagulation postoperatively.
Right.
To me, I do Lovenox for a week postoperatively. These patients are traveling. We all know if you go on a long flight, there's increased risk of a blood clot forming in your calf. And so I do 7 days. We start the day after the surgery at your first post-op visit, and then every day you get a shot. A very important one to me is the day you travel that morning, so you're safe during travel. But a week post-operatively until you're up and walking, not no longer requiring narcotics, somewhat back to yourself.
One main topic that I see a lot is the ladies with the high BMIs and coming out with a good result. And I can speak to this. My BMI is always high. I'm a big boned girl, but I'm not a fat girl. So explain to me how these ladies with high BMIs or above average BMIs can still come out with this cute little cannon butt.
I always go back to the same answer, which is how good is the skin integrity? So BMI is an extremely old scale that's your height and weight based. And for some people, it's perceived that a higher BMI would give a lesser result. That is absolutely couldn't be further from the truth. If the skin integrity is good, now we are limited to 4 liters of fat removal, but it's about proportions, okay? And so somebody that's short with a higher BMI could give one of the best results I've ever provided, because if you bring in the waist, the flanks, automatically the buttock looks better.
Right.
And if the skin can rebound, it's some of the prettier results I have is in the higher BMI patients. And so it's an unfortunate scale. It's the only scale we have. Uh, but some of the prettier proportion results, because if you bring me, say, sorry, but a bit squared off patient, you can curve them to the most beautiful curves you can imagine, and they have a higher BMI. So you don't necessarily have to lipo all the fat out for a good result. It's about proportions. You bring in the waist, the breast, the buttock look better, bigger proportion, and not even necessarily required at BBL.
Right. So the takeaway with that is your BMI does not define your results. So I wanted to thank you for tuning in to my podcast today. I am Mrs. Jenny Cannon, and this is my husband, Dr. Cliff Cannon. We hope that you got some valuable information from us today. And if you have any other questions or comments, please let us know. And we appreciate all of your support, and please continue to support us. We love you guys. You're what keeps us going.
Thank you. And to all my patients, you're the reason I get up in the morning. It's the thank yous, it's the positive responses, and you know, as before, I'm asked what's my favorite procedure. It's the one that makes the patient happy, whether that's reconstructive, cosmetic, uh, after a dog bite or a breast are bigger, whatever it is. If you're happy, I'm happy. So thank you, and I'll be here. Come to Vixen. We look forward to it. Thank you.